I went on James's course a year ago in Ireland, and I found it remarkable that his methods of treatment in treating tight muscles and strengthening overstretched muscles, and looking at that concept that muscles are pulling on bones, rather than the concept that I would have very much looked at for years, was that the joint was causing the muscle problem. I think this work would add greatly to you know, the work that chartered physiotherapists do and physical therapists do in the United States, to be ahead of the game and to make a difference. And you know, it's not about doing stuff that, you know, is conformist or this is the way we do things. You know, a lot of the stuff that chartered physios do is fantastic, but this will very much add to the tools in the toolbox, and I think that is the crux of it really. And you know, I had actually shoulder capsulitis myself, which James worked on, and I suppose I was a little bit skeptical. I saw the technique and I tried to do the technique myself, and it was fine, but James actually released my shoulder capsulitis in 10 minutes, and I found it quite remarkable that I went from an abduction range of 90 degrees to full pain-free range of movement of 180 degrees in abduction. His whole analysis and the way he looks at things is really, you know, it's a gift, I think, really, and it's something that I don't think he realises how good he actually is, not only as a pioneer, but as a teacher, and how he transfers that information to the student, and how he uses his, you know, his powers of feel and touch, which
Hi, I'm Dr. Kimberly Peters, and I have been a chiropractor for 26 years. We've been noticing a decline in our chiropractic field right now because of the economy. But I've been taking seminars by James Waslaski with orthopedic massage, and I am now including muscle balancing with my chiropractic, and I am seeing profound differences in my clients. In fact, what I can achieve with 3 months of chiropractic, I can do in 3 visits now. And people are astonished at the results because of me adding the muscle work.
Hi, I'm Aubrey Going from Dublin in Ireland. I started training in bodywork 20 years ago. I've taken over 20 different certifications in that time in different styles of bodywork. And I'd have to say Jim's workshops were the most interesting and informative workshops I've done. They took everything I thought I knew about bodywork and just came at it from a completely different direction. It's changed my view of how I approach clinical treatment and also in how I teach my courses. That it has brought quite a new element. The multidisciplinary approach, I think, is really effective. His assessments really tell you what, not just about the symptom, but what the underlying cause is.
I'm Dr. James Malley, and I've been the owner and director of Healing Arts Institute in Citrus Heights, California. I've had the school for 21 years, and I can say that the workshops with James Waslaski are the best that we've offered. He has an incredible amount of information that he packs into the short time that he's here.
Hi there, my name is Patrick Albertsson. I'm from Sweden. I've just been completing the course with James Waslaski in outside Florida in Ireland. And I did my first massage therapy course 6 years ago in Stockholm at Access Institute. And after that, I've been practicing and doing different workshops and myofascial release. And I've been doing really well, I thought, but after this I feel I can do so much better. This is
just took a 5-day course with James Waslaski, orthopedic massage, and enjoyed it really much. And we are planning to bring James to our school, and I know that we have so much to learn from him.
Hi, I'm Abigail Curtis. I achieved my degree 2 years ago in sport therapy. Since then I've been working as a therapist. I currently work with a football team and 2 rugby teams. I also see patients privately, but I do get a lot of athletes that come to me, especially gymnasts. Really, this course is going to change the way that I work. I think for one reason I've realised I work way too hard, and I've learnt some very good techniques to sort of use my body a lot more and to understand the patients as well. Mostly I think a lot of the pelvis work that we've done, the pelvic stabilisation, has been unbelievable.
Hi, my name's Alexander Hooper. I'm a sports massage therapist from London, and the orthopaedic massage training I think is amazing. It's definitely going to revolutionise the way that we treat people in the future with the testing, and the functional stuff is just amazing.
Physical therapist from Cork in Ireland. I got certified with Jim back in about 4 years ago now, and overall his work has helped me change not only my practice and develop myself professionally, but has actually helped change people's lives in a profound way. One patient in particular recently is actually a 65-year-old kidney transplant patient. He actually ran in the World Transplant Games in the 100 metres and 200 metres. He actually won the 200 metres running a 14-second 100 at the age of 65. He's a very fit man.
Hi, I'm Elena. I'm Italian. Currently living in South Africa. I'm a massage therapist and a yoga teacher. I've been taking the 5 days course in Ireland. It has been extremely interesting to learn to approach a quite complicated physical condition and understand how to simple realign and restore the health of a muscle and of a joint.
Not what I expected at all. I was really scared coming on this because of my lack of knowledge, but now I feel really confident.
Experience is unbelievable. Jim spoke about someone who's changed your life, and I can only say, without being cheesy, that he did that. He's made me excited about becoming a really good therapist and using everything that he's taught me, and I can't wait.
I'm a physiotherapy graduate, graduated about a year ago. I feel that after doing this course, some of these techniques are going to shape the way they're going to shape my career. It's going to really make me a better therapist, the way I look at some conditions like frozen shoulders and hips and that sort of thing.
Hi, my name is Mark. I'm from Cork in Ireland. I'm currently working in London. I work with professional cage fighters. Orthopedic massage work has completely changed my outlook on how I approach treatment. So it's not just approaching a symptom as a problem, it's approaching the cause of the symptom as a whole. So it's a more holistic approach. When you bring that into the realm of MMA fighting, if you can posturally alter somebody's body shape or resculpt their body, you can change the way their body works, make them more efficient, so they become fitter, faster, stronger.
Prior to coming here, I wasn't able to lift both arms actually up over my head without some degree of pain. I wasn't able to wash my hair, usual things. I'd wake up and I'd have no power left in my right arm. And I can now do this. Hello, world! I can do this, and there is no pain.
And that is. And I was a national level swimmer at one point in my life, and I've had shoulder injuries. And we assessed a true frozen shoulder, and after the assessment treatment, I have pain-free movement. It's wonderful. It's an opportunity for me to get back in the pool and try recapturing some strokes I haven't made in a lot of years.
Scotland. I'm an Olympic weightlifter, lifting now with the Masters team for Scotland. Absolutely made a huge difference to me, to my training, kept myself injury free. If I've got any problems at all, I go back to see Gary, they put right straight away. So my training has improved, my totals have gone up by 35 kilos in a year. So absolutely
brilliant. Training. And I thought I had my frozen shoulder taken care of until I started working with it this weekend, and I realized I still didn't have range of motion. I had like 35%, and so I actually had a frozen shoulder. I struggled with this for 15 years. I thought I had fixed it with my physical therapy that I had for 9 months of physical torture. I went through all kinds of different doctors, and Jim was able to release it in less than a few minutes after a little bit of stretching, and then also just working on my shoulder, releasing it. I'm just totally amazed.